A radical thought experiment, justice and mental health treatment. Good morning, everyone. Today I want to propose a controversial and thought-provoking idea, a reversal of roles in the mental health system. What if mental patients were given the power to imprison psychiatrists and administer to them the same substances that psychiatrists prescribe to their patients, complete with all the potential side effects? Before diving into this concept, let me clarify, this is not a literal proposal, but a thought experiment aimed at sparking discussion about ethics, power dynamics, and accountability in mental health care. The goal is to question whether the current system is as just and compassionate as it should be, and to explore how we can create a more equitable approach to mental health treatment. Current state of mental health care, psychiatrists hold immense power over their patients. They diagnose, prescribe, and often make decisions that profoundly affect a person's life, liberty, and well-being. While many psychiatrists are compassionate professionals, the system they operate within has significant flaws. Over-reliance on medication. Psychiatric care often prioritizes medication over therapy or holistic approaches, sometimes to the detriment of patients. Side effects and risks. Many psychiatric medications come with severe side effects, including weight gain, sexual dysfunction, emotional numbness, and even suicidal thoughts. Power imbalance. Patients are often in a vulnerable position, making it difficult for them to question or refuse treatment. Lack of accountability. When treatments fail or cause harm, there is little recourse for patients to hold psychiatrists or the system accountable. The reversal of roles. Now imagine a world where the roles were reversed. Mental patients, often the ones subjected to experimental treatments and powerful medications, are given the authority to imprison psychiatrists and administer the same substances to them. This thought experiment raises important questions about justice, empathy, and the ethics of medical practice. Empathy through experience. If psychiatrists experience firsthand the effects of the medications they prescribe, would they be more cautious and empathetic in their decisions? Experiencing the side effects of antipsychotics, antidepressants, or mood stabilizers may lead to a deeper understanding of what patients endure. Accountability and treatment. The reversal could highlight the lack of accountability in the current system. If psychiatrists were subjected to the same treatments, they might push for safer, more effective alternatives. Power dynamics in healthcare. By flipping the power dynamic, we can examine how authority shapes the doctor-patient relationship. Should one party have absolute control, or is there a way to create a more balanced and collaborative system? Ethical implications. While this scenario is intentionally extreme, it forces us to confront ethical dilemmas in mental health care. Informed consent. Patients often feel pressured to accept treatments without fully understanding the risks. How can we ensure that consent is truly informed and voluntary? Justice and accountability. If a treatment causes harm, what mechanisms exist to hold psychiatrists accountable? Is the current system sufficient, or does it protect practitioners at the expense of patients? Human rights. The thought of imprisoning psychiatrists and subjecting them to treatments might seem absurd, but it mirrors the lack of agency many patients feel. How can we ensure that patients' rights are respected in all aspects of care? A call for reform. Other than advocating for literal role reversal, this thought experiment underscores the need for systemic reform in mental health care. Here are some actionable steps we can take. Shared decision-making. Encourage collaboration between patients and psychiatrists. Patients should have a say in their treatment plans and be empowered to ask questions and voice concerns. Holistic approaches. Prioritize therapies that address the whole person, mind, body, and spirit. This includes talk therapy, lifestyle changes, and alternative treatments. Transparency and accountability. Create systems where patients can report harm or malpractice without fear of retaliation. Psychiatrists should be held to high ethical standards and face consequences for negligence. Empathy training for psychiatrists. Incorporate experiential learning into psychiatric training. For example, simulations or controlled exposure to the effects of medications could help psychiatrists better understand their patients' experiences. The power of perspective. At its core, this thought experiment is about perspective. By imagining a world where psychiatrists are subjected to the same conditions as their patients, we gain insight into the challenges and injustices of the current system. Empathy is the cornerstone of effective mental health care. When we fail to prioritize the experiences and voices of patients who risk perpetuating harm, by fostering understanding and accountability, we can create a system that truly serves those in need. Conclusion: the idea of allowing mental patients to imprison psychiatrists and administer treatments may sound outrageous, but it serves as a powerful metaphor for the imbalance of power and accountability in mental health care. Rather than literalizing this scenario, we should use it as a catalyst for change, reimagining a system that is just, compassionate, and patient-centered. Let us work toward a future where mental health care is not about control or coercion, but about collaboration, empathy, and healing. Thank you.